Length-to-tension relationship in the cardiac muscle cells. The length-to-tension relationship is the degree of overlap between the thick and thin filaments. The myocardial cells have a maximal tension at about 1.9 micrometers to 2.2 micrometers, and 2.2 micrometers is going to be the L max. This is the maximal overlap at which there's functional activity between the fibers. As you increase the cardiac muscle length, there's two properties that occur. It increases the calcium sensitivity, therefore binding it onto troponin C increases. It also increases the calcium release from the sarcoplasmic reticulum. A graph presents ventricular end diastolic volume along the horizontal axis and the ventricular pressure along the vertical axis. The curve on the top represents the systole, which is contraction, and the blue line represents diastole. In the upper curve, you'll see that the pressure increases steeply as the fiber length increases. So you can see that it grows up and higher because there is a higher degree of overlap between the thick and thin filaments. So as a result, small increases in length produce large increases in tension because there's more overlap and more pressure. The lower curve shows you the end diastolic volume, which is also known as the EDV. This is the amount of volume of blood inside the heart after it has filled up. The increasing pressure in the ventricles reflect the increasing tension of the fibers as they are stretched to longer lengths. As a result of this, you can see the cardiac muscle cell is slightly more stiffer and denser than the skeletal muscle. Stroke volume, SV, ejection fraction, EF, and cardiac output, CO. Volume is the volume of blood that is ejected on one ventricular contraction, and this is roughly about 70 mLs of blood. Stroke volume is equal to the EDV, the amount of blood inside the heart before ejection, subtracting the amount of blood after ejection, also known as end systolic volume. So SV is equal to EDV minus ESV. Ejection fraction is a way to measure the effectiveness of our ventricles in injecting the blood. The fraction of the EDV that is ejected in one single stroke volume. A healthy ejection fraction should be about 0.55, otherwise known as 55%. So in one squeeze, 55% of the blood should be moved out. Ejection fraction can be calculated as stroke volume divided by EDV. Cardiac output is equal to the heart rate times the stroke volume. CO is equal to HR times SV. Cardiac output is always going to be expressed as milliliters per minute, while the heart rate is measured in beats per minute, and stroke volume is going to be expressed in milliliters. So for example, if you have a normal resting heart rate of about 75 beats per minute, the normal stroke volume is roughly about 70 mLs. Therefore, your cardiac output is going to be about 5.25 liters of blood per minute. Individuals with smaller ventricular chambers, the heart rate is faster since there's less stroke volume. This is a fact that can be exemplified by faster heart rates in females as well as newborns. The Frank-Starling relationship. The Frank-Starling law of the heart, or the Frank-Starling relationship, depends on the EDV, the end diastolic volume. As the EDV increases, there's going to be a greater stretching inside the heart's atria wall, resulting in more optimal overlapping between the thick and thin filaments. This is directly linked to the amount of blood returning in to the heart, called venous return. Venous return is increased either by increase in venous pressure or increase in the time to fill the blood. Venous return is decreased if there is a decrease in the amount of venous pressure or in a reduced amount of time to fill the blood. So for example, venous return increases during exercise due to the action of skeletal muscle pump. A slower heart rate causes the increased venous return because it allows greater amount of time for blood to enter the heart. As venous return increases, the EDV will increase, thereby allowing an optimal overlap of filaments and leading into the increase of a stroke volume. So a positive inotropic effect will generate a higher amount of output at the same exact amount of pressure or same exact amount of EDV. You can see here that there's the maximal overlap occurs right at the middle. So number one shows you when the filaments are fully overlapped, and there are some filaments of the actin myosin that are not engaged. In number two, you can see that most of them are overlapped, however, there's some that aren't. And step number four, that there's a maximal overlap between the filaments of actin and myosin.